Every time we're checking in on the pain, we're reinforcing to our brain the idea that there's something dangerous. The more that you check, the more you're fueling anxiety over the medium and long term. Hello, everyone. Welcome. My name is Dr. Justin Barker. So we're going to be talking today about checking in on your symptoms and why you might check in on your symptoms and how to stop checking in on your symptoms. I want to define what I mean by checking in on your pain. So here are just some examples of what that could look like. And there's really an infinite number of potential ways that you could check in, but here are some common ones I see. Waking up and immediately checking in and going, oh, is the pain still there? And then usually it is, and that can start a series of frustrating feelings or fear feelings or something else. Throughout the day, seeing if it's still there, if it's changed, if it's gotten better, if it's moved, if it's gotten worse, if it's showing up more sitting down or more standing up or more lying down or around this person or at this time of day. Doing an activity or exercise or movement and immediately seeing if it's done anything to the pain. For many people, checking in on the pain becomes constant. It can be increasingly mentally consuming. And I want to highlight that it can also become quite automatic. So for some of you, you might be highly aware that you are checking in on your pain quite a bit. For others of you, you may be doing it without even realizing that that's really going on. So hopefully we can bring awareness to that checking behavior. Here's what's actually going on when we are checking. There is a burst of anxiety or distress, and then there is a checking behavior, which is an attempt to address that burst of anxiety or distress. I want to highlight that you may or may not notice that burst of anxiety. It can be so quick. I'm talking quick, like milliseconds quick. And it can also become outside of your awareness where you're not aware that you're feeling anxious or you're thinking about your pain and then checking in on it. It's actually just happening. If you're not noticing it, that doesn't mean that this doesn't apply to you. It just means that it's more fully become outside of your awareness. And in fact, we want to bring back into your awareness that there is anxiety or distress that's fundamentally driving the checking behavior. Why do we check? At the most simple level, we check because something feels dangerous. That is really at the core of checking behavior. And I want to illustrate this with an example. This is a picture of quite a vicious looking tiger. I wanted to use the example of a tiger to help you zoom out. Sometimes when we're focused on our pain, it's hard to think about how these behaviors really come to exist beyond in a pain context. And I think it can be helpful to see them in a different context. So if you noticed a tiger in the woods or the forest or wherever you were, it would make a lot of sense that you would keep checking in on it. You'd want to know where it was. Is it coming closer to you? Is it moving further from you? Does it look hungry? Does it look happy? You would want to really be carefully examining what's going on. And then even after that tiger is gone, you would likely still be checking in like, it was over in that tree before. Is it back? Is there another tiger? Is there another animal? So we can see that checking in is actually a very natural response to a perceived danger. And what's going on with pain is pain has just become the new tiger. So I want you to think about that pain and the checking in on the pain as like your internal tiger. And I think that's a helpful visual that we're going to stick with throughout today. The extension of this is that if there's no perceived danger, there is minimal or no checking. So as a simple example of this, if you have a stomach ache and you're thinking to yourself, I ate something bad last night, my body's working through it, maybe you have a little bit of diarrhea, or vomiting or whatever else, you still likely aren't checking in on it because you have an understanding or an interpretation that your body's engaged in a natural process to expel or get rid of whatever it was that was creating the issue. Now, conversely, if your interpretation was, maybe I have stomach cancer, you're going to be very interested in checking in on what's going on. Does your stomach feel it today? What's it feel like? Does that stabbing pain mean something even more bleak or dangerous? So the more that you interpret something as dangerous, the more prone you're going to be to checking in on it. You're basically encoding that experience as like a tiger. The problem with checking in on your pain is first and foremost that it doesn't actually help your pain go away. And in fact, usually what's going to happen is it's going to increase anxiety about the pain and possibly increase pain. Every time we're checking in on the pain, we're reinforcing to our brain the idea that there's something dangerous. So it's like saying to the brain, it's really worth checking in on this because this is an issue that I need to pay attention to. And then the cycle that I've described here becomes there's anxiety or distress. We check in on the pain. Sometimes we might feel a moment of relief depending on if that check goes better or worse than expected. And at least we know where the tiger is, so to say. But then inevitably the anxiety comes back, and then we need to check in again. And over time, what happens is the brain learns that pain is a significant threat or danger, and it basically has to be constantly monitored. So instead of checking in, bringing any form of long-term relief, what psychologists have known for a long time is actually the more that you check, the more you're fueling anxiety over the medium and long term. I wanted to give one more non-pain example just to help illustrate the pattern. If you were to text message a friend and then 10 minutes later, you check in to see if they've replied, and then in another 10 minutes you go, oh, maybe I'll check in, they've probably responded by now. And then let's say that the person has not yet responded. The brain can start to learn that the friend not responding quickly is in fact a danger signal. Then that danger signal naturally leads to anxiety or fear. And then you might check in again to see if there's a response. And then if there's no response, there's more anxiety, and then there could be some anger, and then you check in again, and that cycle can go on and on and on. So this is the idea and the pattern of what's going on when someone is checking. And now what I'm going to focus on is how to, hopefully for many of you, finally really decrease or eliminate checking. I'm going to talk about some different steps. I want to say up front that you don't have to follow every step. It's really about finding the right combination for you. And I also want to say up front that depending on your level of anxiety, which really means depending on your level of perceived danger about your pain, this could be anywhere from very easy to do, like, okay, now you have the information so you can really make a change, to very, very challenging to do. So I'm going to try to present this in a fairly straightforward way, but I want to honor the fact that decreasing checking behaviors can at times be very challenging. The most foundational step to hold on to is that anything that you can do to decrease your perceived sense of danger will lead to a decrease in checking behavior. If no tiger exists, there's nothing to check in on. Truly understanding the nature of checking behaviors, I think, is actually the most important step, because it's a lot easier to stop checking or to decrease checking when we have a really clear understanding that it doesn't work. It's worth highlighting here that sometimes when I talk with people about checking, they will then try to tell themselves not to check, or will become very angry and frustrated with themselves. That is not the point here. I would have a lot of compassion if even after watching this, you continue to check a lot. The point is not to be critical or mean to yourself or forceful with yourself. The point is just to be understanding the nature of what's going on. So to reiterate, the nature of checking is that it's an anxious response behavior to a perceived threat. It doesn't help. That's really important. And it actually increases anxiety and fear over the long term. The more that you can just internalize that idea, it will already lead to a big reduction in checking, because you'll start to see, that's not actually accomplishing whatever goal I might have when I'm engaging in it. The next step is to understand the pattern of decreasing checking. And this is really important because for me, I have this knowledge, so I'm able to use it, but most people don't know this, and then it can lead to a common predicament that I'm going to talk about. So if you decide today that you're going to stop checking in on your pain, or for that matter, if you decided you're going to stop checking your phone so much or checking the news so much, it is very, very likely that what will happen is your anxiety will actually go up. And the predicament that can develop for a lot of people is when our anxiety goes up, we can think, oh, that means something is wrong. But in this specific case, if your anxiety goes up, that actually means you're on the right track. So the predictable pattern is if you resist checking, your anxiety will go up. And the reason that it's going to go up is because your brain, again, now thinks that there are these tigers around you, and it's going, danger, danger, danger. You're not checking in on the tigers. You're going to get us killed. However, what we're practicing is it's actually a false alarm. There isn't a tiger. So you have to do some reconfiguring of your brain's interpretation. And then as you continue to resist checking, the anxiety will eventually go down because your brain will start to re-understand that it actually was a false alarm. Sometimes this could take, let's say, 10 to 15 minutes. Sometimes it could take much longer for you to come back down from that high anxiety state. And while that's going on, you do have to practice basically just tolerating the anxiety. But over time, as you decrease your checking, I can guarantee that you will experience fewer false alarms and it will become easier to not do. I want to give you a graphical visualization just to understand again the pattern of how decreasing checking works. So you can see the person here has a kind of baseline anxiety level. Then if you look at the time spent not checking, initially that anxiety, as you can see in the graph, actually spikes. And then eventually it goes down, and then it's important to notice that the line actually reaches a lower level than the previous anxiety. So that would be a good indicator that you've made some serious progress when your baseline level of anxiety is actually going down and staying down. Okay, so now that you understand how that pattern works, the next step would be to intentionally decrease checking and really practice tolerating the anxiety. So this is surviving that peak. It's important to make a distinction here between unintentional checking, which we have no control over, and intentional checking, which you absolutely can control. So you can't control your automatic thoughts. If you wake up, and I've done this for years before, and you just immediately go, is it still there? I think most of you will understand that's not actually something that you chose to engage in. That thought just came in. So psychologists call that an automatic thought. So you can't control your automatic thoughts. You don't need to beat yourself up over it. I wouldn't even really call that checking in on your pain. I would call that more of just an automatic response, an automatic thought. The problem then is that there is also checking that is volitional, or said another way, intentional. And that would be like if you wake up and you go, is it still there? And then instead of seeing that as an automatic thought and not engaging with it, you then started doing a body scan, or you got up and you started doing some stretches, or you did whatever motion would test the pain. So it's that type of intentional checking that we want to especially focus on decreasing. And then again, you're going to have to tolerate the anxiety. So when the anxiety comes, the key is if you understand that graph, then you can interpret that increase in anxiety not as a problem or that you're doing something wrong, but actually as a step that you're in the right direction and the right trajectory of decreasing your anxiety. You just have to tolerate it until it goes down. Oftentimes, if you can identify other areas in your life that you are checking in on, this can actually be a helpful starting place. Back to the phone example, a lot of us check our phone constantly. For those of you with an iPhone, and I don't know if Android does this as well, perhaps it does, it will show you, if you look at it, the number of times that you picked up your phone in a given day. And oftentimes it's in the triple digits. So that's quite a lot. So the good news is, even if you're having a hard time decreasing your pain checking, if you were to start and go, you know what, I'm going to practice not looking at my phone so much, or not checking in to see if this person has responded, or checking the news on my phone, or checking email on my phone, any area that you can decrease your checking behaviors can help all other areas. This is a really useful tool, because anytime that you focus on decreasing checking, what you're actually doing is you're increasing your sense of safety over time. It's helpful to identify what the anxiety or fear that the checking represents is trying to solve, and actually working on addressing it. So here are some really common fears that I see. First of all, I won't get to live the life that I want. I think almost everyone that's dealt with chronic pain has this fear that you're not going to get to live the life that you want. And that is, in fact, very scary. If you take your eye off of it, it will get worse. That can be another common fear. You need to check in on the pain to see what kind of day you'll have. There are a lot of people I work with who basically assess what their day will feel like and the quality of their day based off of how much pain they wake up with. Another big one is other people will feel burdened by me being in pain. So these are just examples. There's a near endless number of potential meanings that we can attribute to fear and what it can be trying to solve by checking in on. But the point is just to try to understand what you're actually afraid of. So it's very easy to say, well, I'm afraid of being in pain because being in pain is unpleasant. But there are people that are in pain, find it unpleasant, and actually still have very little fear. So there are deeper meanings that we attribute to our pain. For me, for instance, I was very afraid of not getting to live the life that I wanted to. And I was also afraid that these kind of so-called prime years of my life, because I had pain throughout my 20s, I was feeling like I'm losing out on this really special time. So once you understand what the kind of deeper fears are that are getting swept up with the pain, then you can actually also start to take meaningful action to work on addressing. So for example, if you're feeling like you're afraid that you won't get to live the life that you want, I think a really good way to address that is to start asking yourself, even if I have pain, how can I be living more the life that I do want to live? Or if you're afraid that other people will feel burdened by your pain, asking yourself, how do I want to handle that? Do I want to communicate with people about my pain? Do I want to ask them if they're feeling burdened? Do I want to try to do something for them to make up for some of the burden that they're feeling? But the point is that checking in on your pain, again, doesn't actually help anything. Whereas if you can identify what the fears really are, then you can take very useful steps that can actually help address the problem. Okay, step 6, reminding yourself that now is different. In my experience, the single biggest reason that people check in on their pain is that before they understood the mind-body connection, they felt utterly terrified. So my longest symptom was 4 years of chronic back pain. When I had chronic back pain and I was going to doctors and it was leading to absolutely nothing and I felt totally lost and I felt totally frustrated, and then I'd go to physical therapists and they'd have me do these exercises where I'd be thinking, there's no way this is going to be helpful. That was terrifying. And for most people that I see, there is a similar terrifying quality where you're going, I'm in pain. It's obviously extremely unpleasant being in pain, and it's deeply scary to consider that life will always be like that. So the key here is to remember that now is fundamentally different. Now you are learning about and gaining knowledge of the mind-body connection. You have different avenues of help, including Curable, and you don't need to be in the pain forever. I think this is a really important message to be fairly regularly communicating to your brain and to your experience, because a lot of people have a kind of traumatic experience of pain before they know about the mind-body connection, and then that fear really stays with them even when they do know about the mind-body connection. So it's kind of like taking your phone and you have to update it to the most recent software system, and the new software is you actually know how to address this. This is one of my favorite steps, beginning to experiment with the idea that you can heal through a more passive approach. A lot of healing is actually about less effort, not more. Now, I don't want to say no effort because there is still effort involved. However, with pain, more effort does not equal a better result. So this is a new idea for a lot of people who are so used to always trying harder. But with pain, trying harder oftentimes will end up actually, again, reinforcing the pain and reinforcing anxiety about the pain. Checking is going to happen. And if you, from today, decide that you're going to check in less, it's going to happen almost guaranteed that you will have a kind of relapse to checking in more, usually when anxiety goes up or when a pain symptom goes up. So when that happens, I would encourage you to just see it for what it is. You fell back into a checking pattern. It's a sign that your mind got scared. It went back into a hypervigilant state. It's trying to feel safe, and you can fall off the horse and get right back on. The reason this is important is that, again, the goal is not to beat yourself up for checking or to start seeing yourself as doing something wrong. The more that you can interpret your own actions as, I'm feeling unsafe, that's why I did this, then it takes a lot of shame or self-criticism out of the picture. Here is the cycle of not checking that we are ultimately trying to facilitate. The less you check in on your pain, the less your brain will perceive pain as being dangerous or being worth your time and energy, the less anxiety or fear that you'll have, which will lead to greater senses of safety, and then eventually the pain decreasing or going away, because the safer you feel, the less likely you are to be in pain. So this is the big cycle, or kind of the big reason why this is such a valuable point of intervention for your healing journey. If you find that you really, really can't stop checking, I wouldn't just keep trying to white knuckle it or try to keep going on and forcing yourself even harder, because at that point, what it suggests is you're just needing more help to feel safe. And oftentimes doing that with the guidance of a trained professional can be extremely useful.